Hello, welcome to another episode of the Ask a Doctor series. Thanks for joining us. For everyone that is live with us on this episode, please let us know where you're joining us from. Just leave a message in the comment section. Now, on this episode, we're going to be discussing the topic first trimester preparations and possible complications. And we have with us in this live a very special guest in person of Dr. Ifunanya Igweze. Now, Dr. Ifunanya Igweze is a medical doctor and the co-founder of Preggify, which is a technology-driven platform that offers 24/7 pregnancy care to career and business women. She's an author of 5 essential books on maternal and child health, with almost a decade of experience in teaching women about pregnancy and childbirth. She has counseled thousands of women in both private and public hospitals, addressing one of the major concerns women have, which is how to safely carry pregnancy and deliver without complications. And most importantly, she's here with us tonight to answer these questions. Please join me as we welcome Dr. Ifunanya Igweze to the platform. Thanks for joining us.
Thank you so much for having me. It's always an honor to discuss issues around pregnancy and childcare because they are the foundation of health generally. So today we'll be talking about first trimester preparation. But before we start, I want to welcome everyone, whether you're pregnant, you're a new mom, or you're a single pringle, but you intend to have a baby in the future. This live session is for you because it can save you and it can also save another woman that may live close to you or your friend in the office. This is very important because tomorrow someone will be looking up to you for advice because you're a mom or they feel like you already have a child and you have more experience than them. And whatever you tell them can make or mar their pregnancy or their lives. I'm going to give you an example. In 2022, while I was working in a private hospital in Lagos, we had this client that registered for antenatal in our hospital, but she was not coming for antenatal because of the nature of her job. So one day she developed leg swelling, which lasted for a few days, and then she asked her colleague, who was a mother, she said, my leg is swollen. No. Is it how it is in pregnancy? And that one said, of course, it's not pregnancy. Pregnancy will show you so many things. Leg swelling is one of them. You need to just change your slippers and your shoes, and you'll get back to your normal size after the delivery. Little did they know that at that point, it was not just an ordinary leg swelling. Before you know it, like around 38 weeks of her pregnancy, 36, 38 weeks, she was wheeled into the emergency of the hospital where I was working and she was unconscious. She was bleeding and unconscious. And by the time an ultrasound was done, we noticed that her placenta had separated, what we call a brochure placenta. And then her blood pressure was very high and her urinalysis showed like she had like three pluses of protein. So what was happening to her at the point she was speaking to her colleague in the office was early onset of hypertension in pregnancy. But because she didn't make it to the hospital and she didn't even have access to a platform where she could actually talk to a doctor to get exactly the right information, they delayed a lot. So it's escalated to preeclampsia, and before you know it, the placenta separated, the baby died before they could get to the hospital, and luckily she survived. She was very lucky. Why did I tell this story? This is because sometimes when we want to teach about pregnancy, a lot of women feel like, I've done this thing before, I know it already, or I'm not pregnant now, or I'm going to the hospital. You know, all those thoughts keep coming to your mind. The thing is that the fact that you have even given birth to two babies does not mean that you know what you're supposed to know. Okay, so you need to actually join this live, write down your questions, and listen to what we're going to teach. Okay, so Welcome once again. If you are already here and you're on YouTube, you can drop your comments to show that you're here. And you can share the link to this live to your friends and everyone to join us. All right. And I believe that at the end of this session, you will likely know why my community women calls me Dr. Wede Pampa. Okay. All right, so today we are going to focus on first trimester of pregnancy. You know that pregnancy is divided into three or sometimes into four. So we have the first trimester, which is the first 13 weeks. Then we have the second trimester, which is 13 weeks up to 28 weeks. Then we have the third trimester, which is from 28 weeks to term when you deliver your baby. And then the fourth trimester is after delivery, like delivery after delivery, and up to 42 days after your delivery, that is up to your 6 weeks. But today, for the benefit of today's session, we are going to just focus on the first part of your pregnancy. Why is it so important? Why should we spend 1 hour discussing first trimester of pregnancy? This is very important because most of the losses that happen in pregnancy, which we call miscarriages, happen in the first trimester. And before now, I used to think that as a medical student and as a young doctor, I used to think that because the book told us that first trimester miscarriage is almost, you cannot prevent most of them because they are usually chromosomal abnormalities, they are these, they usually cannot be prevented. But in the past 2 years, going to 3 years, working with pregnant women closely outside the four walls of the hospital, offering them personalized attention, I find out that first trimester miscarriages are usually preventable. But you have to do some work and you have responsibilities. And these responsibilities are things that we're going to discuss about today. We are not going to jump into the first trimester of pregnancy because whatever that is going to happen in your first trimester of pregnancy, you have to set the tone from the time before you conceived your pregnancy. If you do not set the tone, if you do not make the right preparation, you may be setting up your pregnancy for a miserable end. So, for us to talk about first trimester preparation, we have to talk about preconception care. Preconception care is a word that is not popular in Nigeria and most African countries. And even in the Western countries, many people don't go for preconception care, especially Black women. Okay? And preconception care is very, very important, whether it is your first pregnancy or your third pregnancy. I'm going to tell you a reason. During preconception care, the one that many women pay attention to is how to calculate their cycle. When is their fertile period? When is my free period? When can I conceive? What is my chance of conceiving a female child? What is my chance of conceiving a male child? How can I conceive twins? Things around fertility. That's where women that go for preconception care usually pay attention. But the truth is that conceiving pregnancy is one. Sustaining the pregnancy is another one, another issue. So, if you're going to get pregnant, you can get pregnant today and lose the pregnancy the next week. Take it from a doctor who also lost the pregnancy in first trimester in 2022. Okay? So, if you don't make the right preparation, you may be setting your pregnancy up to failure. Okay? So, while you're paying attention to understanding your cycle, when to conceive, how to conceive, you need to ask yourself, what other things can I do to make sure that when I finally get this baby, one, this baby is going to be healthy, it's going to be a healthy fetus. Because if you conceive with an abnormal embryo or baby, the embryo is going to fail. It's not going to live. So you see that the bulk of the work starts from even before you start meeting your partner or your husband. Okay? What I usually see, because I'm going to be using Nigeria as a reference, but this cuts across Black women, okay, of African descent. What I say a lot is that people just wake up and say, oh, I missed my period. and that's pregnancy. Okay, but that is not supposed to be, because for your embryo to be healthy, there are things that you need to do. There are processes you need to follow. There are sacrifices that you need to make. Okay, both physically, nutrition wise, mentally, and if you like spiritually. Okay, so you can't just wake up and say, oh, I just woke up with pregnancy. You are not, you are not giving that pregnancy a chance to thrive. You are not giving it the best chance that it could get. So if you are planning your pregnancy and you don't want to have, you want to prevent at least things that are preventable. Don't get me wrong, there are things that can happen in your first trimester of pregnancy and they are inevitable. Inevitable means that they are unavoidable. You can't wish it away, except miracle happens. There are things that is written. Like your doctor will not even see it coming. You are not seeing it coming. And when it happens like it's gone. But you see, majority of the complications and the losses are things that are under your control. And you're going to find out as we proceed. Okay, so number one thing that you need to do is to book a preconception care with a doctor or an experienced midwife. Okay, so during this preconception, let's take away the fertility part where you calculate your cycle and everything away. That one is sacrosanct. Almost everybody knows that. But you need to work on other factors that can influence your pregnancy. Number one is your physical health. Are you healthy? You can say, oh, yes, I'm healthy. After all, I go to the market, I go to my workplace, and I come back and I'm healthy. No. Health is a state of physical, mental, and social well being, not just an absence of physical diseases. It's not because you did not have broken leg or broken hand or bleeding. You think you're healthy. So you need to be sure that you're healthy. But we're going to start with your physical health. Number one is, do you have a chronic disease that you're suffering from prior to now that you're not pregnant? Do you know if you have hypertension? Do you know if you have diabetes? Are you asthmatic? Do you have epilepsy? Do you have HIV, hepatitis B, syphilis, hepatitis C, name them? Do you have any of these diseases? Because they matter. If you have any of these diseases, if you screen for them and you have them, you need to go and treat them first. If they are the ones that are not treatable, they are not curable, you need to manage them to a point where they are in what we call stable states. They're in a place where we call stable states. So when you get to that point of stable states, you will now say that, okay, for instance, if it's HIV, you get to a point where the viral load is very low or negligible, that you will not be able to transfer it to your baby. If it is hepatitis C, you have to treat it completely and get certified that you are clean before you conceive. If it is hepatitis B, you treat it to a place where the viral load is very low, that cannot, cause problem in your pregnancy, and also prepare you to save towards injections that your baby is going to receive immediately the baby is born, so the baby don't get those things. Okay, so if it's hypertension, you have hypertension, you don't just say, oh, my blood pressure is high, then you get pregnant. That pregnancy is going to fail. It's likely going to fail because you did not manage this hypertension even before you come into pregnancy. So complication is bound to start very early in that pregnancy. And sometimes you may even find out late. And if it is diabetes, you treat it to a stable level where it is, stable and normal or close to normal before you conceive. So preconception care is the foundation of a healthy pregnancy. You have to do your test to be sure that you don't have already existing disease that will impact your pregnancy and set your pregnancy up for failure. Okay? Then, number two things that you need to check is, what drugs are you taking? If you are having a chronic disease like epilepsy, asthma, hypertension, you need to talk to your doctor that, oh, I want to conceive in so and so time, and I am taking this drug. I want to know if they are very safe in pregnancy. If they are not safe in pregnancy, there is going to, tell you, okay, these ones you can be taking it until you conceive. As soon as you test positive, come to us so we can change these drugs because they can affect your baby in the first trimester. Okay, so you have to check in with your doctor. Which drug am I taking? All these drugs, maybe you're on steroid, you're anti convulsion, like anti epilepsy or anti seizure drugs, some antihypertensive. You need to change them. Okay, then number three, you need to assess your nutrition. What is your BMI? What is your waist circumference? Let me see if my tape is here. Uh, so when you want to, you go to the gym or a pharmacy that is close to you if you don't have your weighing scale at home. I don't think my tape is, I think it's in the other drawer. Okay, you check your weighing scale, you check your weight. It's not enough to just check your weight. For you to get an overall idea of how healthy your weight is, you need to match your weight against your height. And how to do this? To measure your weight in kg, it could be, let's say that you're weighing 85 kg. Then you go to the wall and measure yourself. You put a line on the wall where your height is. And then you get this tape, tailor tape, and use the centimeter part of, side of it and measure that height. Then open Google and type BMI calculator, BMI calculator. When it comes out, just click on it. Where it says weight, type 85 and change. If it's kg, you will see where they will ask you to put it kg or pounds. Then you see where they ask you for height. You put your height in cm. The calculator will convert it to meter and calculate it. So if your BMI is above 25, you are overweight. If it's not above 30, you are obese. So are you going to go and get pregnant with weight like that? No. The right thing to do is to go and work on your weight, because weight plays a role in your pregnancy. It even exacerbates your risk of developing diabetes in pregnancy, and it can worsen your risk of miscarriages. So the best thing to do is that if you're overweight or your waist circumference is above 88 and above, you need to work on it and get your weight down by at least 10 to 20% before your pregnancy. And this is going to help you to sustain your pregnancy. Another thing you need to look into your diet. If you're someone that eats recklessly, you need to give yourself 4 weeks to clean up your system before you get pregnant. You know, all those junk, sugar things, all those things that do pish, pish, pish when you open them. Okay, let me not call anybody's name. You need to stop them entirely or just keep them very low. You need to keep down low on your carbs and put more vegetables and leafy vegetables and fruits to build up your blood level. Okay, to build up your blood level. Then you also need to stop some harmful substances that you're taking, like alcohol. If you smoke, is a no-no. If you take alcohol, don't say your grandmother took alcohol and nothing happened to your mommy, and your mommy took alcohol and nothing happened to you. I don't think that you're okay. Because if you're okay, you will not be saying things like that. Okay, so if you are taking alcohol, you need to make sacrifices, about that alcohol, so that your baby don't have brain damage, during the pregnancy and later, or develop mental health disorder, neurological disorder later in life because of alcohol use in pregnancy. All right, so these are some of the things that you do before a pregnancy to make sure that you're setting a good foundation for that pregnancy. Another thing that I want to mention before we proceed, because even though this live is 1 hour, I want it to end in the next 30, 45 minutes. Okay. So another thing that we need to talk about is, please, I wanted to write about this again on my social media, but now that I'm here, let me share it. If you have suffered hypertension or diabetes in pregnancy, in your previous pregnancy, whether the pregnancy you have the baby or the baby died or you lost the pregnancy, please, don't just wait for 1 year or 2 years and then try another pregnancy. It's not the right thing to do. The right thing to do is to meet a doctor. Okay, I understand that sometimes you may meet a doctor and they may not really care or show much concern towards you, but I pray that you meet someone that shows more concern. Okay, and when you meet that person, that doctor, tell the doctor that you had preeclampsia or hypertension in pregnancy or diabetes in your previous pregnancy, and now you want to conceive in the next 2 months or 3 months, and you want to know what to do to prepare your body before that conception. So recently we had a client that came in. She said, "Oh, I had preeclampsia in my previous pregnancy." So the woman came in and said she had preeclampsia in her previous pregnancy. Baby came out at 2 weeks. Now she's pregnant and she probably saw some social media and she registered with Preggify. So when she came in, I asked her, are you okay? She said, yeah, she's okay now, just that she had preeclampsia in her previous pregnancy. I said, okay, but can I get your blood pressure? She said she thinks it's normal. She has not had problem. I said, can I get your blood pressure? And guess what? She's just like a few weeks in. She just missed the first period, and it's not even up to like a month after then. And she's pregnant. And by the time she checked her blood pressure, that's was it the same day or the next day? It was high. She was shocked. It was high. So it means that she is now carrying a chronic hypertension into a pregnancy in a woman that is known to have preeclampsia in her former pregnancy, in her previous pregnancy. It's a high risk pregnancy. So imagine that this woman didn't like see a platform like Preggify and then she continues with her normal stuff because the first so the issue that happened in her first pregnancy was that the hypertension was diagnosed very late and the baby had to come out prematurely. And the same issue would have repeated, and this time it would have been worse because the blood pressure was already high in her first trimester, just a week, 2 weeks after her missed period. But now we have already placed her on a natural remedy. She's not on medication yet. We've already placed her on natural remedy. And when she sent me her blood pressure today, I was like, "Yeah, improving." She was like, "Doctor, I'm so happy." She shouted and said, "I am so happy." I said, "Don't worry, just continue with what we are doing because we don't want you to be on medication for now. But the blood pressure is getting down." So it is important for you to fight all the battles that you have before you conceive. Some of them you may not win them completely, like I said, some of them are not curable, but they can be managed to a point where you build a stable level for it before pregnancy. Okay. So another thing that you also need to check is your blood level. I am one of those people, women, that live with borderline PCV, 30, 31. But when I wanted to conceive, I worked on that PCV like my life depended on it. And I got it because if I've been surviving with 30, 31, it's just me. Ifunanya, okay. I wasn't sharing my blood with anybody, but I was going to share my blood with someone. I don't even know whether it was going to be a twin. Do you understand? So I needed to beef up my PCV. I had to pay attention. So first of all, you deworm yourself in case you have hookworm infestation or worm infestation. So you deworm yourself because those things can stop your blood. That even when you're taking blood tonic and everything, your blood is not appreciating because as you're taking it, the worm is just taking everything. So you need to deworm yourself before pregnancy, and then you start working on your blood level. You start working on your blood level through diet, leafy vegetables, protein, fruits, and then you can take supplements like iron, which is folate, folic acid, vitamin B, vitamin C, and then make sure that your blood level is at least 36 before you jump into that pregnancy, so that if anything is happening in that pregnancy, you don't go below 32 no matter what is happening, or 30, or you don't go so bad that by the time intervention comes, it's already late for you. Okay, so you don't do that. All right. So now that we have talked, I know this list is not exhaustive. There are so many other things that you can do. If you are asthmatic, you need to meet your doctors to check with your level, how stable you are. If you are epileptic, you need to see a neurologist. If you have a heart problem, you need to go and do your ECG. If you have, whether you have a teeth a toothache or not, you need to go and see a dentist before your pregnancy. I'm going to tell you a lot of stories today, and I don't mind whether we just end after this story. So, in 2021, no, 2022, when we started Preggify newly, we had this client that joined us. Almost every Eke market day, she's in the hospital treating infection. Her white blood cell is always high. They always diagnose her with sepsis. The hospital could, where is this sepsis coming from? She was looking like toothpick, like this. She was pregnant though. She was looking like toothpick. From first trimester, she was suffering. Into second trimester, I think she met us in her second trimester. And if I call her, she said she's in the hospital. They were doing blood transfusion. The thing was eating up her blood, draining her blood. PCV is always low. So one day, I gave her a call. I said, I want to take a proper history of this your pregnancy. That was supposed to be done by the hospital because it was a government hospital. But I told her, I'm going to set up a call and take a proper history. I must find out where this infection is coming from. Guess what? During our conversation, I realized she was having toothache. One of her teeth was decayed. So from her teeth, it was sending bacteria all over her bloodstream, and they kept reflecting in the eating up her PCV, reflecting in her full blood count that there is an overwhelming infection, but nobody knew where it was coming from. Eventually, we found out. I told her we are getting this tooth out at once because it was 33 weeks and the hospital was already giving up on the baby. That this woman has the baby will not be okay. Let them kukuma not do any more thing for her. They gave up on the baby. I told her I'm not giving up on the baby. Baby is okay. We got the tooth out. We referred her to another hospital, a higher hospital. We got the tooth out. She was treated, and that was the end of the infection and the whole PCV issue. The baby is going to 2 years now. Yeah, if he's not already 2 years. So sometimes you may not have an obvious toothache or tooth problem, but because pregnancy reduces your immunity, even a simple hole or just a crack or something in your teeth or your tooth can just become something very serious, and it's going to impact your pregnancy negatively. So dental appointments is very important. I do mine every 6 months. Even when I was leaving Nigeria for my studies, I knew how long I was going to stay here. I know they were going to give us insurance, but I know that insurance doesn't cover dental care in most countries. So I did my dental check and my eye check in Nigeria. This lens, I got it new. My dental care, I went to the dentist, I did my test, I did my scaling, I did everything I wanted to do in Nigeria before I left. I'm not even pregnant. So you need to go for a dental appointment and make sure that there is nothing in your teeth that is going to cause you problem in pregnancy. Do your scaling and polishing to remove debris, scales, and everything in your teeth and keep it clean. And then if you have insurance, or you can go for your eye check. Why eye check is important is that you want to know how stable how clear and stable your eyesight is, so that if you start noticing blurry or vision in pregnancy, you know that something else like preeclampsia must have come into that pregnancy. All right, so and then I know a lot of women develop earache and ear infection in pregnancy. You may also want to do an ear test and ear examination with your ENT surgeon to be able to know that, okay, everything is okay before your pregnancy. Now that we have gotten that out of the way, let's talk about you, that you're already pregnant and you are in your first trimester. So, in your first trimester, a lot of things are going to happen. This could be your first pregnancy, it could be your third pregnancy, it could be your fourth pregnancy. Trust me when I say that every pregnancy makes you a first-time mom. Yeah, if you get one of my books, The First Time Mom, you are going to read it in the introduction. People were asking me, why did you name this book The First Time Mom? Don't you think it will be limited to the first time? I say, no. Every pregnancy makes you a first time mom. So the experience you had in the first pregnancy is not the experience you're going to have in the second. It could be better, it could be worse, it could be just something entirely different that you're not even expecting. Okay, so you have to treat every pregnancy as a new pregnancy. Treat it as though you're a first time mom. That is the best way to stay safe in pregnancy. Don't let familiarity rob you of your curiosity and your motherly instincts. Okay, so if you're pregnant and you're in first trimester, a lot of people will give you advice. Oh, do this. This one is normal. You'll be so anxious. I don't want to lose my pregnancy. Hey, is this thing normal? Is this sign normal? Am I supposed to sport? Am I supposed to bleed? This pain now, is it normal? This headache. Ah, a lot of things are going to happen. And you keep asking yourself, is it normal? Google will become your best friend every day. You are Googling, okay. Oh, and Google is going to send you to emergency units because that guy is a crazy fellow. Okay, so when you're in your first trimester, the first thing I want you to do for me is to relax, calm down, relax. Many people love you. Your mom, your mother-in-law, your sisters, your colleagues, your best friend, they love you. And they're going to come with a lot of like advice. They're going to give you advice upon advice upon advice. And because you feel like it's coming from a good place because they love you, but the advice they are giving to you, how safe is the advice? How correct is the advice? So my dear women, I call my pregnancy women Preggify because they are the finest preggy in Africa. So my dear Preggify, what are the things that you should look out for when you are pregnant in your first trimester? Before we go into that, let me say this thing that just came to my mind. Please, I forgot to say something. Before you conceive, make sure you're on folic acid for at least 3 months. I know some of us may not make it to 3 months, but make sure you take folic acid for at least 1 month before you conceive. Why is this important? When you give birth to your baby, I'm going to use my watch as an example. I'm not in Nigeria. I have babies in Nigeria that I use for simulation. Let's say this is your baby. This is the head of your baby. This is the tummy. This is the leg. At the back of your baby's tummy is the spinal cord. Okay, so let's use this here. So when your baby is developing, during the first trimester, before you even confirm your pregnancy, your baby's spinal cord and the brain are almost done with their development. Imagine that. Like before you even confirm your pregnancy, your baby's brain and spinal cord are already developing. And guess the guy that helps them to develop very well? Folic acid. Now, imagine if you do not have enough storage. You don't have enough because you're eating junks. You don't even have proper meal. You don't eat vegetables. You don't eat fruits very well. And you're already pregnant and you're not on folic acid. Your baby could have what we called spina bifida, could have club foods, could have unfollow, could have even brain damage or improper brain development. Okay, so you need to be on folic acid. But why people online you may read online from some women who wants to be medical doctors that teach about pregnancy. Okay, you may read online where they tell you to be on folic acid for 1 year. Please don't do that. You have no business being on folic acid for more than 6 months. Okay, if you have taken folic acid for 6 months, take a break. Take a break, maybe for 3 months before you start again. Okay. The reason is this: women should not be on folic acid every year, every day. You're on folic acid 6 months, 1 year, 2 years, you're on folic acid because you're trying to conceive. The reason is this: folic acid, even though it repairs tissues and help with forming your eggs, help to improve sperm. So your husband also needs to be on folic acid, help to improve sperm health. You know, it also can trigger cancer growth. So if you have a risk factor that predisposes you to developing cancer, the cancer cell might just be a dot like this initially. See this pen? It could just be a dot like this initially. Then you keep taking folic acid. At some point, folic acid will keep developing it, and it turns into a full-blown cancer. So, protracted intake of folic acid, I don't advise. But if you're trying to conceive in the next 3 months, it's fine. You can start your folic acid immediately. Don't say, oh, doctor, I'm planning to conceive in 2 weeks' time. Let me start today. That 2 weeks is very important to your baby. And sometimes you don't even know how pregnancy is going to treat you. Some of you might not be able to take down water or any food or any meaningful medication in your first trimester. So the storage that you have from the previous folic acid you have been taking before your pregnancy is going to carry you through that rough period, and your baby will not develop all those complications. Okay, fantastic. Okay, so now that we have cleared the way, let's talk about abnormal and normal signs in pregnancy, in first trimester of pregnancy. Okay, what are the things that when you see them, you know that these ones are not normal, and what are the ones that when you see them, you say, I know this one is normal. But before you go into that, remember that this is my mantle, for every of our pregnant women. I always say, it's better to be paranoid and your doctor tells you, ma, it's okay, it's normal, than to form that and then they say, I wish you came in earlier. I wish you were here earlier than today. So when you feel that instinct that this thing looks normal, but I'm not sure, check it in with a doctor. And I'm not trying to like hide Preggify, but this is one of the things that you can actually do on Preggify, because sometimes it is the stress of going to the hospital that make women to present to the hospital late. But when you have a platform like Preggify and you are registered, you can easily, chat with a doctor or call a doctor and say, I am feeling so and so. Is it normal in pregnancy or not? And then the doctor guides you through the next step. And it's as simple as that. Okay. So what signs will you see? I'm coming. So I'm trying to get my wisdom because I've been talking off my head. So I want to be sure that we get everything that we need for this. Okay. So what are the signs that you will see in your pregnancy and you say this is normal and this is abnormal? Number one, in your first trimester, you're expected, many women, not all women, majority of the women are expected to vomit, to have nausea and vomiting, which we call morning sickness, even though there's nothing morning about that sickness. It is all day sickness. There's nothing morning about it, but you call it morning sickness. So you're expected to, most of the women are expected to have nausea, and majority are going to vomit. The vomiting depends on ranges. So vomiting that allows you to eat food, but you just vomit maybe 2 or 3 hours later, but you keep down some food and water and you're not feeling weak. It's normal in pregnancy. However, this does not mean that it should not be treated or it should not be managed. It's different from what I'm saying. What I'm saying is that these things are things that are expected. Of course, even at Preggify, when you're vomiting, we place you on home remedies and everything, to make sure that life becomes bearable for you than it would have been. Okay, but I am just saying that these things are expected. However, when you're having a vomiting that when you put food in your mouth, you vomit. You put water, you vomit. You take fruit, you vomit. Anything that enters the mouth, you vomit. You don't even have anything down your stomach. You may be having what we call hyperemesis gravidarum, that is excessive vomiting in pregnancy. And this excessive vomiting in pregnancy is not a good thing for you and your baby. So you may need to talk to your doctor about it. Sometimes He may respond to medications, oral medications, injections, or even natural home remedies can work for you. But if he doesn't, sometimes women might be admitted in the hospital for proper care for that, so that you don't trigger a miscarriage or even die from there because you're losing a lot of fluid and electrolytes. Okay, so there is a normal vomiting that can also be treated, but there is excessive one that you should not keep to yourself. Number two is that you feel weak. Yeah, is there's a hormone that helps to support your pregnancy called progesterone. That progesterone is a lazy hormone. It makes you lazy. It makes you feel exhausted. It makes you feel sick. You know, if they bring you up, you just want to stay down. It's just what it is. Okay, progesterone causes that. However, there's difference between fatigue and dizziness. Pregnancy does not make you dizzy. Pregnancy can make you weak, but you are not gasping for breath and you are not fainting. It's okay. If pregnancy makes you to feel dizzy or as if you are going to faint, please, it is not normal. It could be that you're losing blood, maybe you're having an ectopic pregnancy, especially in um, first trimester of pregnancy. You're having a ectopic pregnancy, which is your pregnancy must have been planted in outside your womb and maybe probably ruptured and you're having that. So, and it's actually an emergency. Or it could be that you have started that pregnancy with low PCV. Or it could be that you have severe malaria that was not treated. I didn't even mention malaria. You need to treat malaria before you conceive. If you do not, it could be a sign that, oh, you have a severe malaria that is affecting you. So you can be weak, but please, you are not supposed to be dizzy, having fainting attack. Those ones are an emergency. You can have breast tenderness. That one is normal due to hormones. Okay. You can have mild in the early phase of your pregnancy. That period that you can have mild cramp, like during implantation week. You know, you just have mild cramp. Sometimes you even have spotting, pinkish spotting. You know, then just to signify the baby, because when your baby is implanting in the first 2 weeks of after fertilization, they are going to, when they're implanting, not in the womb, they have to open the womb, burrow inside it to implant. So that burrowing can cause micro injuries to the blood vessel there, leading to those spotting and contraction that you're feeling. But it doesn't sustain. It just happens and then it stops. Okay. If your cramps turn into menstrual cramps, the cramps is not stopping, and you can actually feel it, or the spotting is spotting and it doesn't stop. It's a cause for alarm. It's not implantation. Talk to your doctor or your midwife, depending on which country you are. If you're in the UK, you likely talk to your midwife first or your GP. If you're in Nigeria, you know, usually the doctor first. Okay. Sometimes you may have increased urination, urinating frequently. Okay, it's part of the hormonal problems and the pressure on your bladder. Then sometimes you may have food cravings. You know, you start craving things, but please don't crave clay, olo, what they call it, clay. Don't crave it. Don't crave hair. Don't crave mattress. Don't crave sand. If you crave those things, they are signs that you're having likely having iron deficiency anemia. So you need to talk to your doctor to check your iron level and supplement it. And then you may have mood swing. This one is normal now. Even during your menstrual cycle, you have mood swing. So it's normal. So what are the things that when you see them, you know that these ones are not normal? You need to talk to your doctor immediately. When you're having severe cramps, abdominal pain and cramps, like ah, it's sharp, it's persistent. Like I said, it's persistent. It doesn't stop. You know, when it comes, you feel pain, then it's persistent. You know, whether it is with blood or without blood, my dear, they waka they go hospital though. Okay. You know, the best thing you can do is that if you are going to pass scan center on your way to the hospital, you can branch to the scan and get the scan. Say emergency, emergency, get the scan done and then move to the hospital. If not, if the hospital where you're registered has a scan, just move straight to that hospital. That's the best bet for you. If you experience bleeding that is not like light pink, that is implantation, or you're now still experiencing, you know, all of a sudden, whether you have missed a period, you start experiencing bleeding that comes and they are sustained. When you put pad, there's spotting, they may be bleed. Don't wait. And one of the mistakes okay, let me tell you another story. So 2 weeks ago, probably the woman must have blocked me. 2 weeks ago, or 3 weeks ago, a woman reached out to me to join Preggify. And I said, what is the problem? Do you have any problem that is prompting you to join Preggify so we can solve it before you join? She said, oh, she was bleeding and her nurse placed her on the fasting and told her to stay at home, that she's having a miscarriage. Huh. I said, okay, what else? Did you do a scan? She said, no. Have you done a scan in this pregnancy? She said, no. And you said that your nurse placed you on the fasting and told you to stay home, that is a threatened miscarriage. She said, yeah, that the nurse examined her and noticed that it was a miscarriage. I said, how did the nurse examine you? Did she open your leg and put a speculum, a device inside and view inside? Or did she just touch her? They said she touched her tummy and said it was a threatened miscarriage. Say, I can bet with this my watch that that person is one nurse that learned how to do nursing in one hospital beside their house. All those self-imposed nurses. Because there is no qualified nurse that will see a woman that is bearing in pregnancy and would not send the woman to the hospital or request for a scan. And I told her, do you know that it's possible that you're having an ectopic pregnancy and you're joking with your life? She said, no, the nurse said it's not a ectopic pregnancy when she touched her tummy. That is threatening miscarriage. And she told her to wait. After like 2 weeks, they will now go and do a scan. I said, I've not even done a single scan in this pregnancy. And you don't even know where your baby is, whether it's in the tube or inside the womb. Just because it's bleeding, you think it's miscarriage. Not all bleeding is because of miscarriage. Miscarriage is the easiest thing that will happen to you in pregnancy. Highest. Miscarriage can happen for up to 2 weeks and nothing will happen to you. Ectopic pregnancy kills in seconds. Like even when you're already in the hospital, you can still die if they're still wasting time to diagnose it. It's that bad. And it's usually a painless bleed. It doesn't show pain. So you have to be careful with bleeding, whether you're passing clots or not. It's best to go and check, get a scan done, and see what is happening inside there. Then, like I said, if you're having excessive and persistent vomiting, you can't keep down food, you can't keep down water. It's not a joke. You can actually die from it. Losing your pregnancy is just the easiest thing to do. It's very painful, but that's the easiest thing that could happen to you. You can actually die from this. So you need to talk to your doctor and get yourself in the hospital. Okay. Then, if you all of a sudden you develop fever and you check yourself with thermometer, I just want to hope that the people I'm talking with, the pampered women I am talking with here, are women that have thermometer at home. Okay, if you don't have thermometer, please get one today. Whether you're pregnant or not, as long as you're a woman, get a thermometer and keep at home. Okay. So if you are having fever in pregnancy, not the one you check with the back of your hand. This is not thermometer. This is the back of your hand. It's not thermometer. Don't transfer the generational thermometer to another generation. Go and get a thermometer. Okay. So when you get your thermometer and you measure, and you're measuring at least 38 degrees, you're having serious fever. You need to talk to your doctor, okay, because something could be going on. I've already talked about severe dizziness and fainting. It's usually due to, it could be low blood pressure. People, if you're like me, that is battling like on a normal day, my blood pressure is usually 8 something, 55, sometimes it drops to 65. So if you're on our level, pregnancy will drop your blood pressure more in the first 20 weeks. Your blood pressure is going to drop before it picks up again. So it could be a sign that your blood pressure is dropping. It could also kill. So it could be anemia and it could also be ectopic pregnancy if you feel that dizziness or fainting. All right. And then if you feel burning sensation when you're urinating or pain during urination, when you go to pee, you are noticing that it's painful, is irritating, is burning you, you may have urinary tract infection. So you need to get it checked out because it could cause a miscarriage, it could damage your kidney, and it could result to first trimester miscarriage. All right. If all of a sudden you notice that you're having swelling on your wrists, your face is swollen, and you're having headache, please talk to your doctor. Sometimes we define, so in medicine, we define preeclampsia to be diagnosed after 20 weeks. But I've seen a woman that developed preeclampsia at 16, 17 weeks. Yeah. She developed, her hand was swollen, face was swollen, leg was swollen. That was in 2022. One day, this picture flew into my DM. Pew! Doctor, I know I'm not registered, but please save me. I don't think that I've gotten the right care. I said, okay. I looked at the picture. Said, you pregnant? She said, yes. I said, where are you? You are a minute away from death. She said she just came out from the hospital. They gave her antihypertensive and told her to go home, that she'll be fine. I said, oh, what's your blood pressure? She told me, that was too high. That's an hypertensive emergency, you know. And I asked her, your protein, is that protein in your urine? She said, yes, the major protein in your urine. And they let you go home. I said, wear your clothes. As I'm talking to you now, I'll move to General Hospital Ugondo immediately. Don't go back to any private hospital. Move to the General Hospital. And please bear in mind they may terminate the pregnancy. She said, no problem. She went there. They tried to manage the thing within 6 hours. Nothing. So they had to terminate the pregnancy to save her life. So this is some isolated cases where you see women that had chronic hypertension that was not diagnosed in pregnancy, and then it was not managed. So the preeclampsia came faster than it's supposed to have come. So don't say, hey, let me wait for 20 weeks or 20 weeks before I start monitoring myself. Make sure you have your fundamentals, your basic, things in place. Let's say that you are pregnant, you feel this vomiting, nausea, this fatigue, and all of a sudden, all those symptoms stopped. Like they suddenly stopped. You need to be worried. Why this is normal in some women, when you told me about it, in fact, there was a time we had a client in the UK who all of a sudden her pregnancy symptoms diminished. And she called me, said she cannot feel anything, any pregnancy symptom again. And in the UK, they usually don't do ultrasound until around 13 weeks of your pregnancy. So she was telling me that they will not allow. I said, don't worry, just call your midwife and cry to her that you are not feeling any pregnancy symptom again. And because I have had issue of previous miscarriage, that you want to get a scan done. She said, okay. So she called them and then they granted her a scan. Luckily, the baby was there and she was okay. So she had peace of mind. I had peace of mind. Everybody was happy. Pregnancy moved on. She had already had her baby. So sometimes this diminution of pregnancy symptoms before 16 weeks could happen. I know I extended it to 16 weeks. I know first semester is 13 weeks, but I know I extended it to 16 weeks, but most of the symptoms will get diminished around 16 weeks. Okay. All right. So I hope you are taking notes, and it will be best that you save this live. I hope this live is it's going to be on YouTube. Save this link. Anytime you feel like you need to refresh your mind, come here, fast forward the video to the session you want, and listen to it. Okay? So before we conclude for the night, let me also mention to you that the best time to register for antenatal care is as soon as you diagnose that you're pregnant. As soon as you test positive to pregnancy test, that is the best time to register for antenatal care. Don't wait for 13 weeks. Don't wait for 6 months. Whether it is your seventh pregnancy, don't wait for that period. Go and register and get your basic tests. HIV, urinalysis, blood pressure. Get those basic tests done first so that you have a basis that they can compare. So let's say that you came in with blood pressure of 170, and then along the line of your pregnancy, suddenly your blood pressure moves to 130, 85. Do you know that is a significant increase, and you could be managed for hypertension in pregnancy because the increase is significant. So sometimes it is not always when you have 140, 160 that they will start saying you have hypertension in pregnancy. There's a significant jump that can jump. There's a significant increase in your blood pressure that will happen, and they will say, we need to act on this. we need to manage this person. So make sure that those basic things are done and documented, and make sure that you attend antenatal classes. Antenatal classes are very important, and trust me, unlike our mothers, we are very lucky. Before now, for everything you have to do in your pregnancy, you have to always go to the hospital. If you want to attend pregnancy class, you leave your work or your business and go to the hospital. If you have cough in pregnancy or constipation, you go to the hospital. If you Before now, you always go to the hospital for everything. But the good thing is that now you can look around you and find a platform like Preggify where you can have 247 access to pregnancy support, so that you can easily have access to doctors, to midwives, ask questions, get your pregnancy classes done online, and do a lot of things, so that you know that whatever is taking you to the hospital are things that are really, really necessary. And by doing this, you make sure that you know that your pregnancy is safe and you're doing your best for your pregnancy with an informed mindset. So thank you so much. And yeah, I hope we have questions to answer. Yeah, thank you so much, Dr. Sophia.
Thank you so much. Thank you so much, Doc. In fact, I was stunned by all the things I heard. Like I've never heard of pre-conception care, right? I've never heard of that before. And it just made so much sense because coming to think of it, literally, if you're really checked prior to conceiving, so many things can be spotted early, which will just be taken care of that would have posed a threat to the pregnancy. So thanks for that. I will keep that in mind. I'll keep that in mind for my next pregnancy. So quickly, we are out of time. From our audience, are there any questions? If there are any questions, we'll take them now. We'll take them now. And then while we wait for questions, please, I want us to be aware that you can get access to Dr. Ifunanya through Preggify, right? The link is in the is in the comment section. So just check down below. You can Preggify. That's to have 247 antenatal care all through your pregnancy journey with Dr. Ifunanya through Preggify. So check the link, register, and get more information on that. And then there are also books that she has written. We have 5 essential books on pregnancy and childcare, right? With a very huge discount. I checked the site. If you're buying the 5, you're getting it for the price of 7,500 instead of 21,000 if you were to buy each, right? So please take advantage of these things. In fact, while you were teaching, something came to my mind that I just wanted to share. I think for every pregnant woman, this is just me pleading, right? You don't want to make the decision of childbirth a money decision because it will cost you. Like there was something Dr. Ifunaya said that was just on my mind. The easiest thing you can do to yourself is to literally lose that pregnancy. That through miscarriage, it's one of the easiest. You don't want that. You don't want that at all. So just get information, get the care you need, get the books that have been written. There are 5 books. I think the first one, there is one on for first time moms. And I heard that, right? That if you are for every pregnancy, you're a first time mom. So I will get it. So please get the books, first time moms, episiotomy care for African women. There is also 15 most important labor and birth questions. And then there is 5, okay, sorry, basic things every woman should know before a cesarean section. So please get these resources for a very huge discount if you're getting the 5 of them at once. And then also, please, you can reach out to Dr. Ifunanya. You can register with Preggify for your antenatal care. And then you can also follow her on all her social media platforms. She's on Instagram. Preggify is also on Instagram. She's on Instagram as Dr. Ifunanya of Preggify. Then Preggify is also on Instagram, right, as Preggify. And then she's on YouTube too. She's on YouTube. There are contents on YouTube and the rest. So please take advantage of these resources. Please, are there any questions from the audience? Okay, there is none for now, and we are far. I think our time is up. So thank you so much, Doc. Thank you so much. Thank you so much. Like, I feel like, in fact, this was first for me because, just like you said, pregnancy does not really mean you are knowledgeable. What you don't know, you still don't know until you learn it. And so I learned a lot. Like, I learned a lot. I'm really, really grateful. Thank you so much, Ma. So, since we don't have any questions, I think we'll leave you to rest. I know you had a long day and you still showed up. I'm really grateful. Thank you so much. Thanks for joining us.
Yeah, thank you so much for having me, and I hope we do this again in the future.
All right. I'll be so glad to invite you again. Thank you so
All
much.
right, okay. Enjoy the
Take
rest of
care.
your night. Yeah,
Yeah, you too. Bye.
yeah, bye.
Now, for everyone that joined us on this live, thank you so much. I trust you learned a lot. I did personally, and all the resources to get access to Dr. Ifunanya is in the comment section, so you can reach out to her. And so it's a wrap for us on this particular series. Please, I would love you to join us on the next series next week, Saturday, same time, 8 p.m., same platform, Jemi Baby Care, with the next doctor who will be taking us on further on this journey of pregnancy, what you should know, what you should avoid, and basically how to prepare for the journey while you are in it and even before you get into it. So that'll be all from me tonight. Have a lovely night rest.